Good morning, students. Today we are going to see the roots of drug administration, and it is a very important question in the general pharmacology. Then, what are the common important questions they ask in the routes of administration? Is oral route of administration, sublingual route of administration, intramuscular, and intravenous. Then, very rarely they will ask what are the factors affecting the route of administration. Like that, they will ask, but majorly important. These are the four things. Then, what is called routes of administration? For any drug that exerts its pharmacological effects, it must be reach its site of action in the body. For example, anything or any pathological condition or physiological condition should be corrected means the drug, whatever you administer, it has to go and act particular site. Now, how it will go particular site, it's depending upon the what route you are administering. That's a simple. Then, how you will classify the routes of administration? Here, simple how you are administering, where you are administering. Based on that, these routes of administration are classified into three routes. One is the eternal routes, second one is the parenteral routes, third one is the topical routes. Eternal routes again is divided into three types. One is the oral, sublingual, and rectal. Then parenteral routes are divided into intravenous, intraperitoneal, intramuscular, intrathecal, intramedullary, intraarterial, intraarticular, subcutaneous, and inhalation. These are the nine or parenteral routes of drug administration. Then topical routes, transdermal, conjunctival, vaginal, urethral, and inoction. Here, how you can remember routes and site is on the name of the route only. Name the site where you are administering will be mentioned. It's a way you can easily remember where it is going to administer. Now, all the students will have the some problem. You know the details regarding oral route of administration, but how you represent in the exam is very important because your representation will carries the marks. It means you represent neatly, then you will get the good marks. Then question will come how I can represent if they ask oral route of administration or how I have to start writing the thing. Here, first thing is whenever you see any route of administration in the exam as a question, first you should write that route will come under which class. Either it will come eternal route or either it will come in parental route or either it will come topical route. First line should be that. Second one is the site, means where you are going to administer in the body. Third one is what are the merits or what are the advantages. Advantages and merits both are same, but one different books will write different words, but either you put as a the merits or advantage, both are same. Next is the disadvantage. Third one, last one is the example. If better you write example drug with the disease, then you will get the more marks because all the students will write same thing. How you represent differently will give the more marks. Then whenever they ask any routes, what you have to write first is under which class or which type it will come. Then cite, merits, demerits, and example. These are the four headings you should remember. For example, if I say oral route of administration. Question is write notes on or write the answer for oral route of administration. First thing, oral route comes under oral route of administration will come under eternal route. Then site, it will be swallowing a drug through the mouth. Then what are the merits and what are the demerits and example. Like that you have to write under each heading. Now whatever I am going to tell in this PowerPoint regarding the routes, all will have the same sequence. Okay, you listen carefully. If you want to, if you are interested to take the notes you can take down or you can have listen and memorize it. It's a simple. Then first thing is why it's called as a eternal routes. Why they gave name as a that. Here, simple thing is whenever you administer any drug in any part of the GIT tract, that is gastrointestinal tract. Whenever you administer any drug, any part of the gastrointestinal tract, it is called as a eternal mode of administration. Here, what are the GIT we can give? One is the oral, sublingual, and rectal. These are the major areas where we can administer the drug into the GIT tract. That eternal route is a placement of drug directly into the any part of the GIT tract is called eternal mode of administration. Now we will go and see individual drugs. One is the oral route. As I told, site, it's a swallowing a drug through the mouth. Then what are the merits? Merits means advantages. Always you compare oral route with other drugs, other routes of administration. What are the advantages? Okay, it's most commonly used method. It's a very safe and it is very convenient, and here no pain. That's why it is a painless procedure. Next, it is a less economic. Why it is less economic means you need to prepare very any special things or very sterilized thing, because it's going to the oral route. That's why it's cost very less amount. Okay, these are all called as a merits. But in the oral route, most of the merits are less, but very keen they will see examiners is what you are written the day merits, because it's the most common route and most of the time we will prefer this route. That's why it will we will see the more what you are written the day merits. Then what are the demerits? Okay, drugs have slow onset of action as their absorption is slow, because when you take the oral route drug, it has to go GAT tract, absorb from GAT, then go to the liver, then again it has to enter into the systemic circulation. That's why it will take long time to act. That's why oral route is not preferred in the acute condition. Any acute condition or emergency condition, you cannot use the oral route. That is a very, very important demerit. Then highly polar drugs and quaternary salts. Highly polar and quaternary salts are not absorbed from the GAD. Highly polar drug example is streptomycin. Quaternary compound salts are DTC, that is D-tubercularine. These type of drugs. Here I have given only example. There are some other drugs also, but simple is highly polar and quaternary salts cannot absorb from the GAT tract, because these will have high molecular size, or their molecular size will be big. That's why it cannot absorb from the GAT. Whatever you administer, it will excrete in the fecal matter. Then, drugs having the first pass metabolism, that is before entering into the systemic circulation, they will metabolize. Like that, if you give the oral before entering into the blood, they will metabolize. Then their efficacy will be reduced. Like example is morphine, isoprene. Then drugs destroyed by the gastric HCl. Then you have given the drug oral. When it is enter into the stomach, in the stomach we have the HCl. That will destroy the drug, means you cannot see any effect. Then your doubt will come, how I can remember these things. Here simple is, any drug is made up of with proteins, or it is made up of with amino acid. Like the drugs, you cannot give the oral. Means you can give, but it will be destroyed, because in the presence of acid, these proteins will be denatured. That's why they don't show any effect. Here, simple is, any drug is made up of with amino acids, or it is a protein nature, then it will be destroyed. That's why you cannot use in the oral route. Even if you give, it won't show any effect. Drugs that destroyed by gastric digestive juice, penicillin, insulin cannot used in this route. Then highly palatable drugs cause vomiting, because if drug have so much of palatability or so much of smell or something like that, pungent smell is there. When you take inside, it will get you will get the vomiting sensation. Then it will cause vomiting. Then this route cannot use in the unconscious patient or uncooperative persons. For example, unconscious, you cannot take inside. Then uncooperative means if you try to put, they will spill it out. That's why you cannot use these to patient. Patients having nausea, vomiting cannot use this route, because already they have the nausea, vomiting. You cannot give. Or if you want to, sometimes you can get the doubts. Or normally if we have vomiting, we will take the oral tablet, because you can take it, but during that you cannot give. Okay, after vomiting 10 to 15 minutes you can give, even if it is vomiting, that it will be cyclic. That's why, but cyclic or heavy vomiting is there, or very nausea is there, you cannot use it. Okay, then what are the most commonly using drugs in the oral route? Aspirin and paracetamol. Aspirin we will use for pain, paracetamol for fever. This is the related to the oral route of administration. If you write these points in the exam, you will get good marks. But you have to write along with the examples. Next, come to the second one, sublingual route. The drug placed beneath the tongue or crushed in the mouth, spread over the buccal mucosa. As a picture, you can see this is the tongue, and below that you will keep the drug. It's called as a sublingual route. Sublingual. This is the lingual. Below we are putting sublingual. Or either you crush it and expose to the mucosa. From these mucosal blood vessels or whatever blood supply is their mouth, it will absorb into the systemic circulation. Then what are the merits? It's a quick concept of action, because rapid absorption taking place through the buccal mucosa. because in the buccal mucosa it will absorb faster, then it will show produce a faster effect. Next, directly drug enter into the systemic circulation. That's why it's not have any first pass metabolism. But if you see in the oral, drug will go inside the GAT tract, then liver. That's why it is undergo first pass metabolism. Here, most of the drug will absorb from the buccal mucosa. That's why you won't see any first pass metabolism. The drug can be spitted outside if side effect are observed. Here, this is the best advantage. Recollection or recollection of the drug will only possible in this route, no other route. Once you administer oral, you cannot take back. You give IM, IV, any route, if you give the drug, you cannot take back. But in the sublingual route, one of the advantages is you keep the drug below the tongue, then you see any nausea or vomiting getting, then you can spit it out. Then you can reduce the severity or adverse effects development. This is a very, very important point. When you write the sublingual route, this point should be mentioned. Okay? The drug can be spitted out if side effects are observed. Then what are the demerits? Same thing. If a drug is very distasteful or irritated, drugs cannot be given. Then high molecular weight drugs cannot absorb in this route, because high molecular weight they cannot absorb from anywhere. Like that, you cannot give high molecular weight drugs. Example: what are the things we will use? Nitroglycerin in angina, nifedipine. These are the drugs we will use in the sublingual route. Then in the sublingual route, what is the major part is it has it is devoid of first pass metabolism. Then it can be spitted out when adverse effects are developed. Drug can be spitted out when adverse effect is developed. These are the two very, very important points should be mentioned in the exam. Then come to the rectal route. Yes, through the rectum. As I pictures I showed you this. This is a suppository. There are two types of preparation. One is the enema and suppository. Then merits can be useful patients having nausea, vomiting. Then you can think in what patients we cannot use rectal route. It's a simple diarrhea. If any person have diarrhea, you cannot use the thing. It's a simple. Nausea vomiting patient, you can use the rectal route. Diarrhea patient, you can use the oral route. Simple. Then first pass degradation is largely bypassed as a major portion of the drug is absorbed from external hemorrhoidal veins. Here, yes, if you can't remember this much big sentence, just write it is a divide of first pass metabolism. But then useful for gastric irritant drugs like pungent smell drugs or oily drugs, or that things will cause some disturbance or some discomfort during the taking. That type of drugs you can give in the rectal. But only one important problem with the or demerits are chances of rectal inflammation. That's a major important, because small area you are exposing high concentration of the drug. That's why chances of rectal inflammation. Next, absorption is unclear, unreliable, because you don't know how much drug is absorbed from the rectal route, because sometimes external hemorrhoid will contract or relax. It's why blood supply will be not be uh, constant. That's why you will see the unreliability in the absorption. Then inconvenient and embarrassing into the patient is a simple. If you tell to give the choice to the patient, this drug you can take oral or rectal. What do you prefer? No, automatically patients will prefer oral because it's a more easy. But rectal route it is little convenient and embarrassing to the patient. Then what are the drugs can be give? Glycerin or aminophylline. And one of the important thing you should remember is diazepam is the given intrarectal, given rectal route in the children's will have epilepsy. That's a very, very most common important example. You can write it. Then parental routes. Here parental routes means through something we are administering drug into the systemic circulation. Here thing is drug directly enter into the systemic circulation. But in the first case, it goes across the membranes and enter into the things. Okay, that's why it's parental routes. First one is the intravenous route through the lumen of the vein, mainly anticuboidal vein. This is the way how we will administer the intravenous route. Here you can see the vein with through the needle injection. We can give the syringe. We can give the drug inside the veins. Okay, that's why we are administering the drug into the vein. It's given name as a intravenous route. Intra means inside, venous veins inside the vein we are giving. That's why it's called as a intravenous route of drug administration. Then here site anticuboidal vein. Then what are the merits? Here drug directly enter into the systemic circulation. That's why there is no first pass metabolism. Zero first pass metabolism. Then it is directly enter into the blood and go to the site very fast. That's why you will see the quick onset of action and used in the emergency or acute conditions. Okay, which route we cannot use in the emergency or acute condition? Just to have the answer, quick onset of action used in the emergency condition, then less dose required to achieve the desired plasma concentration. Here, if you combine the dose for oral and intravenous, intravenous required less dose than oral, because if you give the oral, it has to undergo so many like stomach, then again liver, so many places it will undergo metabolism, it will absorb less. That's why 100 if you give, maybe 80 or 60 may enter into the blood. Here, intravenous, you are directly giving to the drug. That's why what desired effect you want, dose is required for intravenous is less compared to other routes. Then this route can be even used in unconscious, uncooperative patient, nausea, vomiting, diarrhea patients. Then hypertonic and GIT irritant drugs can be used can use in this route, like a hypertonic solution or GIT irritant or nauseating, pungent smell. All that things you can give into the intravenous. And one of the major important thing is, and compared to all the other routes, large volume of dose you can given only in this route. Large volume you can use, because you may be seen in the diarrhea patient or unconscious patient or hypovolemic patient, they will be giving saline 5 6 bottles, almost 6 7 liters they will give. How they are possible? It's only one route is possible, you can give high volume. Then amount of the drug can be controlled with the accuracy not possible by any route. Then here you can control the drip rate. You want to give only 2 mg per ml per minute, you can control 1 mg per minute, you can control. Giving the drug and how much has to go inside at how much time, all you can control in your hands. It's your control. You want to give high dose, you can give. You want to give low dose, you can give. You want to give maintenance dose, you can give. It's all depending upon your requirement, how you want to give that thing, how much milligram per minute should go, you can control it this route only. Other routes you cannot do that, it's not there, that advantage is not there. Then what are the demerits? Here you can think strict aseptic conditions are required, because if you are not maintain any sterilized condition, there may be chance of systemic infections. Then patient has to depend on somebody for giving this injection. It's a simple thing, because he cannot take its own, has to depend. And always all parental routes will have the pain and risky, because of once drug injected you cannot recall. By mistake, if you are given you want to give 2 milligram but you are given 4 milligram, then you cannot recollect back, then it will cause a severe problem. That's why whenever you are taking or whenever you are giving intravenous drug, you should be very very caution and precaution. Then introduction of any particular particulate matter of air may be produce embolism, which may be prove fatal. This is a very very important thing you should write in the exam. That is, any foreign body or any air bubble enter inside, it will cause the embolism. For example, if it is going to block the blood vessel supply to the brain, then you will get the some problem. Then if you block the blood supply to the heart, then it will cause some problem. Like that, it may cause sometime, it may cause severe damage to the persons. That's why whenever you are giving intravenous, you should be very very careful. There should not be any air bubble while giving. Then drug drugs in the suspension, oily drugs cannot be administered, because they will cause the precipitation or they may not dilute properly. Some problem they will create. That's why you should not give. Then venous thrombosis is the most common problem in the this. And puncturing every same time in one place, it may cause the damage to the veins. Then thrombophlebitis of the vein is another problem. Then necrosis around the site of the injection can result, because if your extravasation occurs, because sometime your needle may not go properly to the vein, sometimes there may be outside leakage of the drug. All that will cause the inflammation, pain, so redness, everything. That's why whenever you are giving intravenous, you should be careful it will enter inside the vein. Then example, normal saline, dopamine, diazepam, we can give. That's related to the intravenous route. Intravenous route merits and demerits are very very important, and most of the time you will use this in the acute and emergency condition. Then come to the intramuscular route. That's a simple drug you are administering into the muscle. That's why it's called as a intramuscular route. What are the site? We will give deltoid, gluteus mass, left or right buttock, vastus muscle. All these things You have to remember any one or two sites you can write in the exam. Then what are the merits? Absorption is more predictable, less variable and rapid compared to the oral route. Then depot injection can be also given by this route. Depot injection you know already, needleless injection. That's called depot injection. Then demerits, perfect aseptic condition should be maintained. Then all parental routes require this thing. Perfect aseptic condition, then chances of abscess at the site of injection, because if you are not diluted properly or if you are not maintained storage condition, that may cause change enter into the body, then it will become precipitate. That's why you should be very very careful while giving the intramuscular. Then chances of nerve damage leading to the paralysis of muscle. Okay, because always you know right, muscle, in the muscle, vein, artery, nerves will be going together. Instead of, if you damage to the nerve, it may cause the distal part of paralysis. That's why you should be very very careful while giving the intramuscular. Then large volume cannot be administered. Maximum you can give 10 to 15 ml by intramuscular route. Then what are the drugs we can give? Testosterone and haloperidol. There are so many other drugs. Just I am giving two. Whatever you drugs you can comfort, you can remember. Then intraperitoneal route is a simple. You are giving the drug into the peritoneal cavity. It's called as a intraperitoneal route. This you can see the here. You can see the ribs ends here. This area is called intraperitoneal. Whenever you administer drug inside, it's called intraperitoneal route. Then merits, rapid absorption due to the large surface area, because peritoneum is a very big surface area, very large, more blood supply will be there. That's why whenever you administer drug, it will absorb very fast. Rapid absorption due to the larger surface area. Then demerits is the same, painful, risky due to the chance of adhesions. That's a very important thing. And if you are not maintaining proper aseptic condition or if you are giving repeatedly, then it will cause a peritoneal infection. It's called peritonitis. Okay, because of repeated administration and all, it may cause the peritoneal cavity infection. That's why it's called as a peritonitis. Then aseptic condition is needed. Then what are the things we can give? Anti-rabies injection for peritoneal dialysis in case of any drug poisoning. All these two conditions we can use the intraperitoneal route. Okay, these are all the important routes I have explained. Rest other routes, it's not much important, but you should know. That's why you just have the look. Then intrathecal into the subarachnoid space. Then drugs will give the xylocaine radiopaque contrast. Then this you should maintain a very important aseptic condition, and it's a, in this route only you can achieve the significant CSF levels. Then intramedullary route, here you can see how they will give the intramedullary route. Injection to the tibial or sternal bone marrow. Then it's a very risky, painful. Then aseptic condition should be maintained, and it's mainly used to when you want to stimulate the bone marrow transplantation and blood transfusion. Then intra-articular route, sorry, intra-arterial route, drug you are directly into the artery. Here you can see one, or here you can see the arteries into the lumen of the desired side of artery. Then great concentration of drug can be delivered at the desired site, because arterial blood supply to goes to the site. That's why we can give to the, if you give artery directly it will go. Then great experience is required. Then aseptic conditions are required. We'll give nitrogen mustard radiopaque contrast media. Then intra-articular injection directly into the joint space. This mainly we will use in the joint disorders. Can anyone name what are the joint disorders? Do you know? If you know that, you can write the uses. Can achieve higher concentration drug at local area. Then normally enter into the joints drug will be very less when you give the systemic route. That's why they will prefer this route. Strict aseptic condition, very painful, but repeated administration in the joint may cause the joint damage. Hydrocortisone, gold salt we will use in the rheumatoid arthritis, osteoarthritis, gouty arthritis, all that condition we will use the this route. Then subcutaneous route is also very important thing. Subcutaneous injection in the site into the subcutaneous tissue under the skin. Here you can see this. Here like this is the skin. You can lift the skin and you administer the drug. And these are the in the person where you put the blue marks. There you will give the common. Then you can get that doubt. Why not other places? They have done studies and proved that these areas, if you administer subcutaneous, absorption will be the more. Other places, absorption will be the less. That's why when absorption less, automatically effect also will be reduced. Then move to the administration. Then depot injection can be also possible, but only thing is you can give maximum 2 ml. Then irritant drugs, you cannot give drugs produce the irritation, hypersensitivity, allergy, all that thing you cannot use. Then not used in the shock. This is a very very important thing. Why we should not use subcutaneous route in the shock? Anyone can guess? Yes, simple answer. Because in the shock, all blood supply will be shifted to the major organs. Blood supply to the skin will be reduced. That time, if you administer the drug, there is no blood supply. That's why absorption of the drug will be reduced. That's why in the shock, we won't use the normally we won't use the subcutaneous. What are the drugs we'll use? Insulin and local anesthetic. Inhalational is a very simple thing. Inhalation through the nose or mouth, faster absorption because it's directly enter into the lungs, then blood supply is very high in the lungs, then that's why it will absorb faster and produce the effect. Quick onset of action and larger surface area of alveoli. Self administration is easy possible, and even if they are traveling or if they are walking, whatever they are, they can take. Then demerits: increase the bronchial and salivary secretion, can cause the bronchial irritation and constriction. Then what are the important drugs we can give? Oxygen and general anesthetics. Then topical routes. One of the topical routes is the transdermal patch. This patch here you can see the in the picture patch. Then that you can stick it on the body. That major areas: chest, upper abdomen, mastoid region. Okay. Then you stick it. From that, drug will be delivered slowly into the thing, blood and produce the effect. Then slow but sustained release of the drug several days. Demerit only irritation. Whenever they get irritation, they can change the site. But every time don't apply same site. You have to change the site. Nitroglycerin and scopolamine. Conjunctival onto the conjunctiva, easy to administer, no assistance is required. Demerits may cause redness and irritation of the eye. Example: sulfacidem, then gentamicin. Here, each route I will show one side by. You have one picture. There you can see how it is administered. Then you can remember very easy. Then vaginal or urethral. This is how they will do the vaginal and urethral of drug administration. Solution, ointment, emulsions, foams, palm drugs used in this route. Then pencil-shaped boogies are available for urethral use. Metronidazole, antifungal drugs. A, B, C, you are seeing the picture. They are all different types of modules to administer drugs. Then inoction is nothing but rubbing of the drug. Just you take one drug and rub on the skin. It's called inoction. Rubbing the drug preparation on the skin. Then it's safe and convenient. But the only thing is how much drug enter inside the body or how much is absorbed. We cannot predict. That's the only demerits. Antifungal and analgesic creams are used. Okay. Other routes of drug administration: intradermal, dermojet, pellets, and biodegradable implants, intracardiac injection, epidural injection. Then here factors affecting the drug absorption or drug administration, routes of administration. You can just think, but here very in this chapter, in this topic, very very important are the oral, sublingual, intramuscular, intravenous, Intraperitoneal. All these five are very very important and most commonly asking thing. All the routes you have to write under the headings of site, merits, demerits, two example with the condition. Only these 5 points you should write. Okay, you can take down the notes and you can write it. It's a very important topic and very easy to understand. Okay, then if you like my videos, please subscribe and share my channel. Thank you.